When I got diagnosed with celiac disease, I was devastated. Something important, essential to who I am, was being taken away. 4 years ago, I started to feel off. I had really bad heartburn and fatigue and some stomach issues. It just felt like I wasn't me. Went to my first gastroenterologist. He ran a blood panel for celiac, and I just laughed at the nurse when she came to take my blood. I would never have celiac. I eat pasta all the time. I would be so much sicker. And when it came back positive, I was stunned. I was already studying what I currently study, which is food marketing. Basically, my whole life revolved around food. So to find out that I had something that limited one of my passions, to me, a celiac diagnosis felt like an entirely different life I was gonna have to live.
I've been doing this for a while, and over the years we've developed protocols, we've identified new tests. The things I do with patients now are very different to what I did 10 years ago. It's changed a lot, and the bulk of the change has been through developments of research that we've done.
10 years ago, if a patient came to us with a very specific set of antibody levels, we would have said, well, this is an unusual result. We're not sure what this means. Today, we can look at the paper that we published in which we described what those results mean in terms of the chance that this patient has celiac disease.
Something that 10 years ago I was not aware of is just the identification that individuals with celiac disease have joint hypermobility and have increased rates of dislocations and also increased rates of fractures due to osteoporosis. It was our early studies that showed that peripheral neuropathy has a very strong association with celiac disease. So when we see people now with neuropathic symptoms, we know who to send them to, we know what tests to do, and we know what therapies they need.
There is a link between a restrictive diet and what happens in the microbiome. There's also a connection between that microbiome and appetite and behavior. So this is a very new area for us to discover and to really dive into it with our research to look at that connection between brain, gut, and behavior in our patients.
In the past, even in the field of, let's say, the microbiome, we've just looked at what bacteria exist and why they exist there. Now we're looking even further to say what these bacteria are doing. What are the metabolites they're making? How does that affect somebody pre-celiac, post-celiac, on a gluten-free diet? And I think in the future we'll be able to pinpoint some of those things a little better and say, we can give this metabolite back to you, or we can give this vitamin back to you, and that will make up for some of the things you're losing either in the gluten-free diet or just by the fact that you have celiac disease.
In the past, we really only understood the individual experience, and through our work, we're really now better understanding the repercussions or the influence of celiac disease on an entire family and extended family. We can now use what we learned to move forward and develop family-based interventions, and then to evaluate those family-based interventions to see if they have an impact not only on adherence to a gluten-free diet, but in promoting quality of life for the individual who's diagnosed.
I was exhausted, like always, anxious all the time. This isn't me. I knew this isn't me.
Anna, you're on.
Doctors told me I had IBS. Some even told me it was in my head. And for a while, I believed them. But I'm stubborn.
I had been misdiagnosed and sort of turned away from doctors time and time again, and nothing was getting better. I had a lot of anxiety and stomach aches and things like that would keep me home instead of going out with my friends, which was something that was super important to me. I'm a very energetic and positive person, and I was getting further and further from that, and I just knew that it wasn't me and it wasn't in my head there was something else going on. My experience of the doctors at the Celiac Center has been great. I mostly work with Dr. Ben Lebwall, and I could talk to him about my frustrations and the journey that I'd been on and my actual human experience beyond just what are your symptoms. He feels like a person on my team, not just like a medical professional.
It's crucial to focus on the needs of our patients. Some people think the gluten-free diet is a fad, and in fact, this is a serious medical remedy for a serious medical condition.
When people say, oh, it's just a diet, it's frustrating to me as the physician. I can't imagine how frustrating it is to the patient when I see situations where a patient doesn't have a definite diagnosis and they're told, oh, just go on a gluten-free diet. It's not a trivial thing. It is life-changing.
My favorite part of my job is when I see a new patient and they come in and they've seen a flyer for a study that we're conducting, or they see a question that we have on the door and they ask me if they can be involved in these research studies. And that really just shows how much our patients play a role in our research, how not only are they bringing ideas to us, but they're the reason we're able to do this research, because what we're really trying to do is help the future generations with celiac, their future of dealing with the disease, and make everybody's quality of life better.
I participated in a clinical trial at the Celiac Center where I had to eat a full slice of matzah, which I found out has more gluten than a slice of white bread. And I was so willing to participate because there's only one way that we get to some kind of cure, is for celiacs themselves to invest in it.
I envisage us being able to tell someone, you've got celiac disease and you need to be really strict because you have a high risk of getting lymphoma. Or you have celiac disease and I think that you don't have to be as strict with the diet because your genetic makeup, the makeup of your microbiome indicates that you're going to do very well with this condition. So knowledge of the genetic makeup of people, knowledge of the microbiome of individuals will, to my mind, allow tailoring of the therapy.
A question I get asked many times is what's on the forefront for therapies in celiac disease. Should I take probiotics? Should I take antibiotics? Is there new medications coming? And I think we're also in a very exciting time right now where I can actually answer that question by saying yes, there are things coming. 10 years ago, there was nothing. It was just the diet, and you met with the dietitian, which is still a fundamental part of treatment, but that's really, it was up to the patient to treat their disease. Now I feel like we can offer more to our patients. There are some oral medications that should come to market in the next few years that help with not curing celiac disease, but at least affecting your response to these gluten exposures. But the fundamental goal is really to find a cure for disease. And I think we're getting closer and closer to that with our research by looking in what actually causes disease.
Celiac disease for me hasn't just been the diagnosis and that's that. There's a lot of follow-up. There's the journey of getting back to health. So they've been partners on that journey and continue to be as I work my way back to my best self.
The kitchen to me is my ultimate Zen space. It's somewhere that I think has really transformed after my diagnosis. I don't have to be worried about what is contaminated and what I can and can't eat. I can go in there and create anything that I desire and basically make it so I live in a world without celiac.
Celiac disease is a chronic lifelong condition. Anyone who is diagnosed with this condition has to face the fact that there's increased mortality risk. Even if you're doing well, unfortunately just having the diagnosis is associated with this increased risk of having a poorer outcome.
Now is a perfect time to amp up the research that the Celiac Center does, because that's how we help the members of society that are struggling with this. Even just getting diagnoses taken care of in a younger age so that people can start paying more attention to their health and working their way towards well-being and not getting as bad as my disease got before I was diagnosed. It makes a world of difference in these individual lives and in families and society as a whole.
What is it that triggers celiac disease? How can we best predict who's going to do very well and who's going to have difficulty? How can we give personalized dietary advice after a new diagnosis? These and other questions we need to answer, and we cannot do it without the support of our donors.
Patient care in the Celiac Centre has improved dramatically. We want people to feel better sooner than later, and that's only going to happen with a big infusion of funds. The disease isn't going away, the increased risks aren't going away, and we're not going away. The only thing that goes away is financial support of the research, which is going to be responsible for making sure that patient doesn't have a bad outcome in 5 years, in 10 years, in 25 years. And so the responsibility in my mind is very much shared between us and the patients and their families.
I was exhausted. That isn't me. That isn't me. And with the center's help, I'm strong.